We actually have this amazing brochure that we can send to a patient that thinks they might have mesothelioma, never been to a doctor before, never been diagnosed. We offer a brochure they literally can take to the doctor's office with them and literally hand it to the doctor and say, I think I have this. Can I have these tests?
The first test for a patient with symptoms related to mesothelioma will be going to their primary doctor, getting an X-ray or a CAT scan done. Based on the results from that, they may go through further testing, such as a thoracentesis or paracentesis, which is where they drain fluid, whether it's from the lining of the lungs or the peritoneal area, which is the abdominal area. The next step would be for a biopsy. The biopsy is a step where they confirm the diagnosis. This sample is sent to a pathologist who ultimately tests the sample taken out from the tumor and identifies it as mesothelioma.
And not just look at it under a microscope by any pathologist, but a pathologist who has an expertise in making that diagnosis. Because even with a good sample of tumor, looking at it under a microscope, it can sometimes be difficult to make that diagnosis. And it's important not only to know that's mesothelioma, it's important to know what is the histological subtype. Is it epithelial, or is it sarcomatoid, or is it a mixture of both, called mixed or biphasic, because that changes the type of treatment.
We handhold them through the diagnostic part early on. So we actually prepare them before they go of what their doctor is likely going to do or what may not need to do based on their previous studies that they've had.